Hi, I'm Dr. Tom Lewis, founder of RealHealth Innovations. We're a health creation organization, and today I'm going to talk on a workshop titled Hypertension. What is it? How can we manage it? It's obviously high blood pressure. What's the causes of it, and how do we deal with it? So hypertension is, we're measuring blood pressure, and we have an upper number called the systolic pressure, and a lower number, the diastolic, and we want these numbers to be in an optimal range. One thing to consider is that with age, the number you have that's optimal for you may be different than for when you were younger. So keep that in mind. And oftentimes doctors don't talk about these age differentiations, but we always consider in the geriatric population, maybe they need higher blood pressure. But let's look at the top 5 causes of elevated blood pressure. So if you have been diagnosed with hypertension and you're on a medication, one or all of these 5 recommendations might actually help get your blood pressure normalized and get you off that medication. So the first thing, and it's a theme in health today, is sugar. What does sugar do? Sugar charges and races into your blood. So high carbohydrates and sugars charge into your blood, and as a consequence, fluids flow into your blood as well. Our body's always trying to create a balance, and we don't want to have this really high concentration of sugar in our blood, so fluid comes in after it to compensate for that. And whenever you have excess fluid, there's a possibility to have excess pressure as well. They go hand in hand. You can't put more fluid, water into your hose unless you create more pressure. It's that simple. The second thing is heart disease. Infection can cause this, inflammation. In a previous workshop, we talked about how calcium can line these vessels because of poor absorption from gut health. So yeah, gut health can be tied to creating hypertension. So we need to worry about heart disease and inflammation in our vessels that causes a narrowing. Obviously, if I'm trying to get so much blood through this pipe, then I want to do the same in this pipe. It's a narrower pipe. I have to apply more pressure to get it through. It's pretty common sense. So potassium. We have a society where processed food, fast foods, restaurants, foods, lots of sodium. And sodium has been demonized, but it's an essential mineral. What really we're lacking is education and knowledge on potassium, because sodium works in concert with potassium in a so-called sodium-potassium pump. They go together, and oftentimes you can lower blood pressure just by increasing your potassium intake and not starving your body of the necessary mineral sodium. So here, bok choy, obviously bananas, but they're very high in sugar, so there are other choices. Squash, lentils, sweet potatoes, raisins and figs, Brussels sprouts are very high in potassium, or you can take a potassium supplement. So potassium is very good at calming vessels and lowering blood pressure. The next thing is kidney disease. We think that the heart dictates everything. All the heart does is pump. It pushes. But the thing that determines the pressure is actually our kidneys. So we look at a scale of kidney disease. This is a number called the GFR, your filtration rate of your kidneys. Think about trying to force something through a filter and the filter is clogged. The only way to get material through, in this case blood, is to increase pressure. Believe me, your pressure is not going to drop unless you're extraordinarily sick, because your body, your brain, your tissue requires the blood, it requires the pressure. So if you have any level of kidney disease, you'll start seeing an elevation in your blood pressure to compensate for the slow filtration rate of your kidneys. One of the more common causes of high blood pressure, and particularly the near high blood pressure, just a little bit elevated, is the doctor's office, where the white coat syndrome makes you a little anxious and your blood pressure goes up. I guarantee you, if you take a cuff at home and measure your blood pressure several times during the day, you'll get several different readings, and it could range from a low to a high value, where the high value would put you essentially in a regime that a doctor could say you require blood pressure lowering with a blood pressure lowering drug. So keep in mind of this, and in fact, the new standards, okay, another source here is the brain. The brain, so how the white coat syndrome works is the brain triggers the fight or flight, the anxiety, the anxiousness, that raises a hormone production called cortisol, which then affects your entire metabolism, including blood pressure. So it's all interrelated. The anxiety, the nervousness will cause your blood pressure, just like you're running from a lion, your blood pressure will go up automatically. So the standards today is if you're borderline or just 5 or 10 or 20 ticks above normal, say 140, 145, 135, what really should be done in the doctor's office is multiple measurements. They should do multiple measurements, and if you're borderline assignable to a blood pressure lowering drug, the new standards actually say the individual should take a home monitor and monitor their blood pressure at home to get rid of the confounding factors of being measured quickly, abruptly in a doctor's office. So you may not even have hypertension. Non-pharmacological interventions. What can you do on your own to reduce your blood pressure? Statistically, every kilogram of weight you lose, if you're overweight, you lose a milligram of mercury. So if you're 10 ticks above the standard and you lose 20 pounds, your blood pressure is probably normal again. A healthy diet, low carb, healthy fats, high nutrient dense foods, foods that lower inflammation are excellent. Balanced salts. If you look at sodium, the RDA is still 3.4, even though some people are being recommended 2.3 grams per day on the salt-restricted diet. But what they really need is stay the course with their salt, but bring potassium into their life. You're not getting enough potassium. These two will counterbalance each other in terms of what's called osmotic pressure, the pressure into the vessels, and keep the pressure down to a normal physiological level. Aerobic resistance and isometric training. If you increase your exercise, you'll probably lower your blood pressure by 5 millimeters, which may be enough to keep you off that medication. And reducing alcohol consumption to moderate levels, 1 or 2 beverages a day at most. If you're above that, you probably see a lowering of your blood pressure benefit from cutting back a little bit. So the reason why we want you to solve the problem non-medically is because the medications have side effects. I like to say all medications are like pushing a mattress underwater. You can push one part in an inflatable mattress, one part goes underwater, another side pops up. So you oftentimes get a negative effect along with the benefits. So those always have to be weighed. So you're better off to be drug-free. So here are some simple side effects of most of the blood pressure medications, from diarrhea, constipation, dizziness, and lightheadedness. If you're getting dizzy or lightheaded on your hypertension medication, you're being over-medicated because your brain is not getting enough nutrients, not getting enough blood flow. Your brain is probably telling your kidneys and your whole body, hey, send me some more blood because I'm working hard up here, folks. I need some fuel. That's what's going on. Feeling tired, lack of energy, headache, nausea, vomiting. So here are some of the drugs. ACE inhibitors is pretty common, associated to renal failure. So even though some may say lower blood pressure to protect the kidneys, the drugs themselves have side effects that can hurt the kidneys. Diuretics, you're shedding important nutrients. It can affect bone density. It can affect kidney health. Beta blockers affect neurotransmitters, cause memory issues. So there's no free lunch with these drugs, so it's best to try to reduce your blood pressure naturally. But the first thing is to get a bona fide good measurement that's not when your fight or flight mechanism in the doctor's office is kicked up and your blood pressure is artificially high. So this has been a workshop on what hypertension is and how to manage it without drugs. My name is Dr. Tom Lewis, and I appreciate you listening.